unmet needs is difficult. I think as palliative care professionals, which particularly as nurses, we're trying to be holistic. And I think one thing in the oncology setting is that I feel a lot of oncology kind of education is very much focused on people who work in a specialist hospital or a hospital, but we forget about the impact these oncology patients have on wider community, so district nurses, palliative care nurses, and we need to kind of work on their understanding of oncology to help them facilitate conversations as well, with these patients, because we're trying to manage patients more often where we can, where possible, at home rather than in hospital. So I think we need to kind of empower these clinicians. I think the unmet need in palliative care, I guess, is further research. It's quite difficult to conduct research in palliative care, and a lot of what we do hasn't been updated for a long time, really, because of the difficulties of conducting research, because of how emotive it can be, and the appropriateness of it. But I think there's lots of research that we need to look into with these patients, of even just basic symptom control. Do we need to, one of the oldest things they use is the WHO pain ladder, which hasn't been reviewed for a long time. So we need to think about how actually this has probably evolved over time, like a lot of oncology practice. But there is lots of challenges to conducting that research. But I'm hoping, like hearing things, for example, like the end of life teaching session for people with children, that's a really pivotal piece of research, in my opinion, as a palliative care clinician, to help improve the care of the family, not just the patient. It's about the care of the family, which is really important.